hip joint issues. How is the hip joint designed, and how does it work in a person who is healthy?
Well, Lloyd, the hip is commonly known as a ball and socket joint. Inherently, it's very stable. You have a big cup or socket, also known as the acetabulum, and a big ball, the femoral head. And it's the most stable joint in the body at the expense of stability, unlike the shoulder, which has a very large ball but a very shallow socket. And subsequently, that's why we can all put our hands above our head, but very few of us can put our feet above our heads.
Mm-hmm.
And as far as how it works in healthy people, it's because of that joint that allows us to mobilize in all sorts of terrain, walking over logs or walking down the sidewalk. It allows us to mobilize all sorts of terrain that we wouldn't otherwise have or be able to do.
Why might someone need to consider having hip replacement surgery?
Well, I tell my patients, when all the conservative measures we spoke of before, everything from home exercising, home icing, formal physical therapy, nonsteroidal anti-inflammatory medication, when all these activities start to fail, and people, they know when this happens. Usually it's a period of time anywhere from 6 to 8 months when your articular cartilage decides that it's had enough, and the patients actually start to make a mental note that they say to themselves, I'm on the other side of the room, I'm going to take care of A, B, C, and D, and they start having this running list, and they do less and less of what they like to do, and more of trouble doing so, and the patient, they know, they'll tell you that everything stops working. At that point, you might consider the option of total joint replacement.
And I'm sure our listeners want to know what recovery is like if they do have to have that hip replaced. Do they typically return to their normal activities, following surgery?
Well, it depends what that activity is. I've had competitive tennis players return to tennis in weeks, and I don't recommend that as the as the optimal situation.
Mm-hmm.
Right. It's we can't control the falls. I mean, downhill skiing in and of itself is innocuous until you fall. But yes, as far as normal activities of daily living, that's the purpose of the joint surgery: stop the pain and increase the function. As far as what recovery is like with these newer technologies we spoke of earlier, computer navigation, alternate bearing surfaces, typically, for example, I have two hip joints tomorrow. I expect both those patients to be out of the hospital by Wednesday and going to outpatient physical therapy within the week of surgery.
And how long do they usually stay in physical therapy, outpatient physical therapy?
That varies. It depends on the patient. For example, if you have two patients who have identical x-rays, in other words, arthritis on a radiographic standpoint is identical, but one stood active and one was perhaps more sessile, maybe wheelchair-bound, it's going to take longer, of course, for that wheelchair-bound patient to recover because there's more recovery, more muscle and tissue. But usually in an otherwise healthy person, by 2 months, everything should be done, physical therapy, and they're really back to doing their normal activities of daily living.
Good morning. My question is regarding my son. He's overweight, for one thing, which doesn't help. His knees are gone. They're bone on bone. He's been told this. The work he does requires very, very heavy lifting, and he's been told if he gets the knees fixed, he would not be able to do that job anymore. What I'm wondering is, does that mean that if he were to get them fixed, that they just wouldn't last as long, or would it be an immediate problem?
Dr. Omari?
Good morning.
Good morning.
If I may ask, how old is your son?
52.
52. Okay. Now, as obviously the stage has reached where it's an end-stage arthritis, and options are considered now. Now, we do have options where either we reconstruct the joint or realign the joint. And by I mean realign the joint, if arthritis is limited to only one side of the joint, the knee joint is formed of two joints. There is what we call the tibiofemoral, or the thigh and the leg bone, plus there is the patellofemoral, which is the kneecap and the thigh bone. And if the arthritis is limited mainly to the tibiofemoral, one side, and as Dr. Sosi has alluded before, in the mechanical axis, we usually walk with the center of the hip, center of the knee, and the center of the ankle should be in one straight line. And when either bowed in or knocked out legs, so that means one part of the leg is involved, you can realign them, and with this procedure, it takes longer to recuperate, but you can go back to heavy manual type work.
Oh.
If, however, if the arthritis is involving more than one joint of the knee joint, then the options will be limited, and once you go and start replacing bone with metal. That's why most orthopedic surgeons, we don't like to go back to heavy manual work, because these are also artificial bearing joints, and the problem with bearing is wear products, and they don't last as long. These joints are designed, yes, more young active, but still not heavy manual work.
I see.
So my advice to you is actually, has he seen orthopedic specialist?
Yes, he has.
Okay. I mean, these are the options, and that's definitely something could be done with realignment, and that's an option could be considered.
Okay. Well, thank you very much.
Thank you, Lucille, for your call. Let's get one more in before we take a break. Let's go to Bruce in Ann Arbor, who has a question for the doctors. Bruce, good morning.
Good morning. I'm calling with an elbow issue.
Go right ahead.
Are you there?
Yep, go right ahead with your question.
Okay. I have what I believe is arthritis in one elbow. Bad enough that at times I can't lift anything with it. It just hurts on a regular basis unless I'm taking heavy doses of acetaminophen.
Dr. Morales?
What can you suggest?
Well, the first question obviously is that I think you need an evaluation by an orthopedic surgeon if you have not had one, or at least your primary care doctor with a set of x-rays, because it sounds like you've assumed you have arthritis, and you do need an evaluation and most likely an x-ray to see that. Has that been done yet?
Not yet. I was looking at making an appointment with my primary doctor next week.
Yeah, well, there's a lot of other things that can occur around the elbow besides arthritis. There's things that affectionately we call tendonitis, which is classically known as tennis elbow, where you can get a point tenderness on the outside of your elbow. That is something that's not arthritis at all, can affect your lifting, and you can also get it on the inside, which is a different group of tendons. So you really need to have an evaluation to determine, first of all, is it really arthritis, or is it a tendonitis, or is it potentially another thing people get, or occasionally they'll get a bursitis around their elbow, which you get some extra swelling and things like that. So I think you really need to go ahead and have it looked at, x-rayed, and then a definitive diagnosis made, and then appropriate treatment from there.